BMHS began operations in 1987 after the Baltimore City Health Department had received a 5-year grant from the Robert Wood Johnson Foundation. This was the Robert Wood Johnson Foundation's first major mental health initiative and involved 9 cities throughout the country. Through the resources of the grant, Baltimore Mental Health Systems was expected to establish itself as the local mental health authority with clinical, fiscal, and administrative responsibility, expand the range of services to individuals with psychiatric disabilities, improve continuity of care, create affordable housing, and implement financing initiatives that improved the quality of care. The challenge for BMHS as a non-service provider is to ensure what we do and what we develop has an impact on the citizens of Baltimore who have psychiatric disabilities. Baltimore Mental Health Systems oversees a public mental health system consisting of over 100 agencies and providers which deliver services to over 27,000 citizens on an annual basis. A priority of Baltimore Mental Health Systems is to develop collaborative relationships with other local, state, and federal agencies, providers of mental health services, private foundations, and other supporters to improve the mental health of those in need.
The overall collaboration with Baltimore Mental Health has been a magnificent collaboration.
We believe a mental health system is only as good as its ability to provide immediate services when an individual is most in need and requests those services. In 1992, BMHS established Baltimore Crisis Response, Inc., BCRI, to offer a range of psychiatric crisis services to any city resident in need. BCRI annually handles over 10,000 calls on its 24-hour hotline, responds in the community with a team of mental health professionals to close to 2,000 situations a year, and operates 12 psychiatric crisis beds as an alternative to psychiatric hospitalizations.
My name is Terry Alston. I am the Crisis Residential Unit Coordinator at Baltimore Crisis Response. Each client that comes through our unit fills out a satisfaction questionnaire, and this is an excerpt from a female client who was recently with us. She says, "I would like to commend all of the staff here for treating me with the utmost respect and making me feel some dignity when I was perhaps at the lowest point of my life. The program did exactly what they said they would do."
In 1999, BMHS, working with a planning group, established a crisis response system for youth and their families. Baltimore Child and Adolescent Response Systems, a program of the Villa Maria Associated Catholic Charities, was established and provides a range of psychiatric crisis services to children, adolescents, and their families. During this past year, they served over 925 children, most who were between the ages of 9 and 15, and of those served, over 95% were diverted from a psychiatric hospitalization. Unfortunately, many of the people homeless on our streets, living in shelters, or living in substandard housing have a serious mental illness. BMHS, in collaboration with HUD, the City's Office of Homeless Services, and a number of provider agencies, offer a range of outreach, shelter, housing, and support services to those in need.
I've been outside for 12 years. I've been homeless and all like that, outdoors with nothing so far and everything else. And John Hopkins been helping me out and gave me a place to stay and so far, a room over my head and all like that and so far.
For individuals who have spent many years in state hospital, the transition to the community is often difficult and challenging. Over the past years, BMHS has developed a number of initiatives to help individuals transition to the community. Close to 200 people have entered these special programs. In 1994, we established our nationally recognized capitation program. This program, operated by the North Baltimore Center and Johns Hopkins Bayview, works with individuals who have been long-term state hospital patients and those who have had multiple hospitalizations in the community. Using a unique financing structure, the program offers individualized, flexible services and has well-defined outcomes and incentives to help improve the quality of care.
Hi, I'm Barbara Harris, and I'm Program Director at Chesapeake Connections, basically one half of the Baltimore Capitation Project. I've been at Chesapeake since 1999, and I call it the possibility place. That being because we work with the severely, chronically, mentally ill client and helping them transition and or change the behaviors that were putting them in the hospital on numerous occasions. At Chesapeake Connections, again, we are very client focused. When our clients come in, we want to know what it is they want, what it is they need in the community, and that's how we structure it. We work on an individual basis with each of our clients, meeting and setting up programs to meet their needs.
Obtaining affordable, independent housing is a goal of many of the consumers of the public mental health system. To help meet this need, BMHS established as a subsidiary Community Housing Associates, Inc., CHA. CHA owns and leases housing to over 250 individuals through a variety of program and resources. In addition, CHA has obtained and allocated over 400 Section 8 certificates for individuals needing affordable housing opportunities.
Oh, I was homeless. I was on the street, went into Project Place, women's shelter, and they set me up with Baltimore Mental Health Systems through North Baltimore Center, and through North Baltimore Center, I got Shelter Plus. Through Shelter Plus, I got housing, and I've been so okay for 5 years now. They've been great about helping me solve my problems and stay with a home. So, results of all that, I got my Section 8, and I'm getting ready to live on my own.
Many experts feel the best place to reach children and adolescents is through school-based mental health services. BMHS has been a leader in this area, working with the Mental Hygiene Administration, Maryland Health Partners, the Baltimore City Public Schools, the Baltimore City Health Department, and Office of Economic Development. We oversee mental health services in over 80 of the city's 174 schools. Of those children receiving school-based mental health services, seen 4 or more times, we have seen significant improvement in their attendance and ability to advance to subsequent grades.
Hi, I'm Barry Williams, the principal of Southern High School, the very proud principal of Southern High School. And I'm pleased to be able to speak to you about our collaboration with Baltimore Mental Health. I get a chance to see the students on a day-to-day basis here at Southern. And many of our students come into school with a lot of issues. Many more issues than what we are able to handle on our own. So obviously we need assistance. And having our partnership really allows us to provide another service for our students that we otherwise would not be able to provide.
Oh, I'm glad that the counselor is here right now, because when I first came to school, I was suffering with a lot of issues, feelings, depression, and now that I'm in school, I'm not stressed out about a lot of things, but now I'm more into graduating. I'm happy about going to college.
It's very easy to make a referral to the mental health individuals. They have been very cooperative. They have assisted us in a number of different kinds of ways, and in many times they've kind of clued us in about some problem areas. And so that's worked out very well.